Welcome to Unleash Curiosity by Vital Pet Life.
I'm Dr. Amber De Silva, veterinarian and advocate for integrative pet care.
And I'm Donnie Yamamoto, founder and CEO of Vital Pet Life. We're so glad you're here.
This is a space where curiosity, compassion, and science converge, where we explore the powerful mind-body connection that supports your pet's health and your own.
Each week, we'll dive deep into the world of pet wellness, breaking down myths, exploring ingredients, and learning from expert voices across the industry.
From nutrition and sustainability to transparency and advocacy, we're here to help you feel more confident, connected, and informed in your care choices.
So let's get into it, because when we know better, we do better. This is Unleash Curiosity. Dr. Christie Long has dedicated her career to integrating technology and innovative ideas to strengthen the bond between pets and their parents. As Chief Medical Officer at Modern Animal, she's leading the way in reimagining small animal practice and shaping innovative care across California and Texas.
With a background that spans clinical practice, international volunteer work, veterinary telemedicine, and so much more, Dr. Long is passionate about advancing veterinary medicine while supporting both pets and the professionals who care for them.
This is very exciting. Let's welcome Christie.
Christie, welcome to Unleashed Curiosity.
Oh, thank you so much, Amber and Donnie. I'm so pleased to be here. I'm excited to chat through what we've been doing at Modern Animal over the last few years. And Amber, it's so great to see you. Haven't seen you since our reunion of our vet school in Colorado. So it's
nice
wonderful to
see
reconnect. Yeah.
Wow. I didn't know that you guys haven't seen each other in years. Yeah. All right. Okay. So, Christy, can you share how Modern Animal started?
I would be happy to. I think it's interesting, the more I get out and about and meet people in the industry, the more I hear stories of, people outside the pet industry having frustrations with getting pet care and then deciding they're going to start a company to, assuage all the problems that they had accessing pet care. I think Modern Animal's story is not completely unlike that. There are some similarities, but also some differences. So our founders were a couple of guys who had worked together at Bain Consulting, which is a financial consulting group, Steve Eidelman and Ben Jacobs. And Steve and Ben's original company was Whistle, which is it was one of the very first collar-based pet trackers. Exactly. They first got bought out by Mars, and Mars recently sold them off to Tractive. So so when Steve and Ben sold Whistle to Mars, they both ended up working in Mars, as often happens when companies are acquired. Ben went into the investment banking fund that Mars runs, Digitalis, and Steve went into work in the Banfield business because by that time Mars had acquired both Banfield and VCA. VCA was just a little bit later, but he, his task that they gave him was no small task. They wanted him to help them figure out how to improve the technology that Banfield uses to take care of patients. And, you may know Banfield wrote its own proprietary practice management system or electronic medical record system called Petware. And it's been out there for about 30 years now. The more Steve got into the business and he did everything, standing in the back of a clinic, helping hold patients while they were drawing blood, talking to clients, talking to veterinarians. And he really started kind of learning much more than he initially bargained for around things like compassion fatigue amongst veterinarians and owner frustrations with getting into their doctors and talking to their doctors and communicating. And then at the same time, he had adopted a dog that he loved very much and found his own frustrations getting care for his dog, something as simple as calling the clinic and not being able to get someone to answer the phone. I mean, this was actually VCA in his case, but yes, I mean, no, I worked for VCA. I have nothing but, fond memories, but, so I think he started formulating in his mind, how could all of this be easier or better? These are problems that people are experiencing. It's not that people in veterinary medicine don't love animals. Of course we love animals, right? That's what we dedicated so many years of our lives and spent so much money in student loans to get to do. But it's us, it's people that are having issues taking care of pets and getting care. So that was his initial idea, was how to create a company that really addresses those problems with respect to the technology that people use and with respect to the design of the clinics, because a lot of physical experiences in the practice, they're not lovely. They don't always smell great. They're loud. They're not comfortable. And that goes beyond just the people who are coming in for a quick vaccine. It's really more of a problem for the people who are spending 10 or 11 hours a day there working. And then finally, he got really interested in just how do you create a great medical experience for people. So I got introduced to Steve via my old boss, a guy named Brock Weatherup, and I had started another company that was one of the very first veterinary telehealth companies. So I had learned a lot in that journey about how people wanted to access care outside of the veterinary clinic. I think I fooled myself when I was a practicing veterinarian that I was the best communicator ever and that nobody ever had any confusion about what I meant when I told them, my instructions. But, the reality is that people just can't absorb it all when they're in front of you. So,
yeah, especially when you're like anxious, right? Like, okay,
oh,
maybe
of
my pet
course.
just had an accident. Like,
If your pet is sick, your pet is vomiting, your pet is crazy in the hospital and you're trying to calm him down. I mean,
you
there's a
cannot
lot going on.
retain whatever the doctor's telling you.
Yeah,
Because
there was a study in human medicine that said the average human patient listens for 7 minutes to the doctor, and then they're done. And so it's probably half of that in veterinary medicine. I don't know, but
that's
so
true.
I got to meet Steve at a conference, met him in 2019, and he told me his ideas. And I'd honestly never heard a person who was not a veterinarian so accurately describe the opportunities in veterinary medicine. And by that time, he had incorporated the company. This was about 4 or 5 months after that. And I signed on, and I have loved working for this company. I had a background as a software engineer before I went to vet school. And so for me, just like getting to integrate what I knew about technology and what I knew about veterinary medicine into this new practice model, it was a job that was basically made for me. So that's how we started. We opened our first practice in April of 2020, and now we have 27 practices across 3 states.
I remember when you guys started, like you had to wait to be a member.
Yes, we joked that it is in West Hollywood, which is, it's Hollywood. We joked that we needed to get velvet ropes and hire a bouncer and put him out front because, it was the pandemic. So we start this company, and literally the day we open, cannot let people inside. Obviously it's COVID, right? And we're doing curbside service. And that was the irony of it all. We had put so much thought into the design of the physical space, and then no one could see it. But we had built an app by that time that allowed video calling. And so when we brought people's pets into the building and they sat in the parking lot in their car, we were able to put them on a video call with the doctor.
Wow.
And so they could see their pet in our clinic. They could see the doctor. They could talk directly to the doctor over video. And it just kicked everything off. And plus, there's 23 million American households got pets during COVID. And so we were quickly overwhelmed, just like so many other practices during that time.
Yeah, I remember that.
Yeah, it was hard to believe. It's been, 5 years at this point, and we obviously learned a lot during that time. And it was, I don't ever want to go through that again for sure, but it made us stronger, I know, and helped us figure out a lot of things about our model. It took us 18 months to open the second practice. I think just because we just felt like we had so many things we wanted to get right before we did that. So we opened the second practice in Pasadena. And then have been rapidly, opening practices since then.
Yeah, I became a member of Pasadena. I waited for it to open.
Oh, that's wonderful. Thank you.
So technology and client experience are cornerstones of your model. So how do you balance innovation with maintaining a personal touch in your clinics?
This is such a great question. One of the things I've been recently talking about I was at Western College of Veterinary Medicine just yesterday talking to vet students about innovation in the jobs that they ultimately decide to go into. And for us, I think the coin dropped, if you will, when we really stopped and asked ourselves, like, who are we doing this for? And I always go back to Simon Sinek's book, which is Start With Why. And he talks about, innovation is the application of technology to solve a human problem. If you're not involving the people who have the problems, then you're probably going to miss the mark. Great. So I think for us, it's been about a couple of things. If we look and we stop and we ask ourselves, what is our why? Our why is bringing humanity back to veterinary medicine, right? Mm-hmm. Making it a place where humans can thrive. And so the people are, one, first and foremost, the people who work in the clinics, the doctors, the nurses, the host, those are the folks who sit at the front desk, but also the people who provide virtual care. So it's all those folks that are actually delivering care. And then the other group of people is the clients, the people who want to use our app to book an appointment or get their pet's medical records. And they want that to be very easy and seamless. And they want to be able to pick up their phone at 3 a.m. when their dog woke them up vomiting to figure out what's going on, or to get some help and direction and guidance about what they should do about that. So those are the two groups of people that we're really serving. And what we realize is we have to involve them in the act of innovating. So for the teams in the clinics, that's meant for us creating a council of peer-nominated doctors, nurses, and hosts in our clinics and our virtual care team, who come together every couple of weeks, and they work with our software engineers, our designers, and we talk to them about ideas we have about technological innovations we want to make, workflow changes we might think are warranted in the clinics. After that, if it turns out to be an idea that has legs, we ask them to volunteer. Do you want to be a clinic to pilot this idea? Do you want to have this new technology in your clinic early so that you can give us feedback about what's working and what's not working? Mm-hmm. And then finally, we don't roll out anything. The yardstick we use is, does this require behavior change from our employees and in our practices and in virtual care? And if it does, then we don't just drop it in, right? We have a full plan around how is it implemented? How are we going to measure whether it was successful? And so that's really important. And then for clients, we ask them every time they interact with us, 2 hours after you leave a modern animal clinic, you get a message in the app that says, how was your visit? And we ask them in several categories. Is it the technology? Was the wait time too long? What are your reasons for your 5-star review or your 4-star review or whatever you gave? And then we also do interviews for our clients. This is a very non-scalable thing to do, but you have to ask them and really get that feedback to find out what is it about what we're doing that works for you or what doesn't work for you. So I hope that answered your question.
Yeah, absolutely. So what is some of the, maybe one really practical thing that you took from that feedback and changed to make that experience better?
I mean, Amber, I could go on. You don't have enough time to hear. And there's been so many missteps we've made. I'll tell you one example that really set the stage for us and kind of, hit us over the head with a board to be like, you got to do this different. So when we started our first practice, we used a practice management system that's available off the shelf. Anybody can use it. You buy it, you pay a monthly subscription or whatever. Mm-hmm. And it quickly became obvious to those of us, and I'm pointing at myself because I'm saying those of us who are building and running this company, that piece of software was really going to slow us down. We wanted to do a lot more. We wanted to change things. We wanted to make things better. We wanted reporting that we couldn't get access to. My personal crusade was always for electronic treatment sheets, electronic anesthesia tracking, electronic dental charting. I don't want people writing stuff on paper. I fully believe that medical mistakes happen when people are using handwriting and are required to write things down. The thing that we missed, though, was that our team in the clinic is using the software that we had at that time. And it wasn't perfect, but that isn't the key to doing their job. Their job is taking care of animals and taking care of the people who love those animals. Yeah. The software to them is just one more tool. It's like a scalpel handle or an ultrasound. and it's got to work. But it isn't the focus of their job. So we decided, and again, I'm talking about those of us who are building the company, hey, we're going to build our own practice management system. And we have a team of engineers and product designers, and we stood that up in 6 months. It was a huge effort, and we dropped it in. I always say it's like changing the wings on an airplane as you're flying it, because, remember, we're a 24-hour organization. So it started out okay. There were some bugs, but that's to be expected. And then suddenly we started having doctors saying, what is happening? I am writing this medical record and I'm coming back into this medical record and what I wrote is gone.
Oh,
and
no.
So Amber, you can imagine how that feels, right?
Yes.
To you as the doctor, the medical record is like the people who come after you are going to look at it. Your team is looking at it to know, like, what are we doing with this pet? And, oh, by the way, pandemic. So, a lot of stress associated with that. So what we realized is that the software we had been using automatically saved all the time as you were using it. And we neglected to build that in to our product. You know what? Because we never talked to anybody. We never understood how important that was. So we had to kind of re-architect everything and rethink everything. And after that, we realized, like, we got to build with these people. They are key and central to the success of anything we're creating.
Yeah. Wow. That's like things that you wouldn't think about that the program just does automatically. And then, yeah. And sometimes probably, you probably experience this too, that sometimes you spend more time on your medical record than you do in that actual appointment. I know that I remember in vet school, there's them saying, like, if you're going to get sued, like, your medical records will save you or hurt you, and so I was always really diligent about my medical records. And so to have it, open up and there's nothing there, that would be devastating.
It's funny. I was just talking with a friend today, also a CSU grad, where you and I both went to vet school. And that one of the things we were talking about was how worried today's vet student is with being sued or going in front of the board. And, I mean, remember they taught us, they used to say, if it's not in the medical record, it didn't happen. And I do think that is important. And I think it behooves people like me, as I'm building this company, to create ways to build a solid and strong and complete medical record without making it the thing that you spend the most time on every day. Because that is not your job is not writing medical records. Your job is taking care of patients. And your medical record can be the most perfect, internal medicine, glowing, medical record. But you might not have done a great job of taking care of the patient or the owner of the patient. So, yeah.
Wow. Well, that's good to know that that's the side of the vet care that you guys worry about.
I mean, Donnie, that is, you brought up compassion fatigue before we started our conversation here. And that is a huge part of it, is just that expectation that you almost have this. It almost creates this kind of adversarial relationship with the client, that it's like, I better write down that I strongly recommended the lepto vaccine and they still declined it, because if this dog gets lepto and the board doesn't see that I recommended the vaccination, I'm in trouble. And it keeps you from being at your best, I think. And it really makes things feel like take on a heavier tone than they need to. So, one of the big recent advances, and when I say recent, I mean like last 6 months in medical record keeping, is AI transcription of the medical record. So my doctors are now standing in the exam room and just talking normally to the client, and that is creating a medical record for them. So it's taken a huge burden off.
Yeah, that is amazing. That's
amazing. And I think that basically answers my next question about, what are the changes in when you started practicing in telemedicine and technology, AI.
I mean, AI is on it's on everyone's lips these days, for sure. And there's many, many applications, all the way from, what I just mentioned with the transcription of the visit, but also things like,
research.
You got that 15-year-old poodle in front of you, and it's got 7 or 8 diseases, and it's been to 3 or 4 specialists, and it's been to Modern Animal 10 times in the last year. That's a lot of information to like try to get into your brain before you open the door and walk into that exam room. And AI does a really good job of sort of giving you a summary. Now, it's not complete. There's going to be more details that you're going to need to dig into, but it certainly gives you a leg up on that.
Yeah, maybe like
AI's
the bullet
Go ahead.
points that you have to remember,
Totally. That's exactly what we do with it. We tell our doctors have that summary before they go in. I think it's going to play a big role too in interpreting diagnostic reporting, diagnostic testing too. Because we run the same kinds of tests over and over again, and AI is actually pretty good at helping kind of figure out what it means and where to go from there.
Yeah.
So there's a lot we can do.
Because sometimes it's not that one number that you see in a clinic one time, like you look at the trends over time for repeat blood work. And so I can definitely see how technology would be really helpful in looking at those trends.
That's one of the things that frustrates me about our lab, even though a value is still within the normal range. And we run a lot of lab work. We are very successful at explaining to people why it's important to do that, even when your pet appears to be well, right? But like, how are we seeing that over time? Even though it's within the normal range, has it been creeping up? Has it been getting more and more to the point that this is starting to become something that is indicating that a problem is maybe starting to surface? So that is like the true, I think that there's so many benefits to AI and how it can help us. We do have to be careful. We have to review and look at everything that AI creates for us, just the same way you would as if a nurse wrote the medical record for you, right? You're putting your name on that medical record, so you want to be sure it's clear and accurate.
Yeah.
But it can certainly help you create that kind of content and get you moving.
Yeah. And I think even, the best veterinarian, the best doctor, like you're going to miss things sometimes, you're going to you're going to have a blind spot. And so using that technology to kind of look at all the possibilities and like, okay, we should think horses, but what about these zebras? Like, let's not forget about that in case something wonky happens or, have your differential list. Because, I don't know how you felt graduating vet school, but I felt like they taught me everything I need to know. I have everything down. I passed my boards. I'm good. And then you get into practice and you're like, oh crap. Like there's so much, even though I learned it in a book, it's so different getting into practice and actually being the one responsible. So having that technology to just to help you not miss things, to look at those trends, to be more efficient. I think that's going to make your job so much easier and more complete, if that makes sense.
It does. Yeah. And the other thing I hope is it gives doctors more time to actually talk to people. The patient, I mean, imagine how clients would feel if the 3 minutes I saved on the medical record because I had AI to help me write it, I could then use and answer another one of their questions or make sure they really understood my instructions.
Yeah.
We're not there to write medical records. We're really, truly there to take care of people and pets.
Yeah, that's good. That's exciting. I'm hopeful for that.
Yeah, it's happening. It's happening for sure. So it's funny. I mean, veterinarians are one of the most conservative groups of people I've ever been around. And I think in general, we're pretty averse to change. But I tell you what, when we brought in that AI soap tool, people quickly adopted it. It's been very successful. So yeah.
Amazing. Yeah.
I remember like the second practice I worked, well, I guess the first two practices I worked had paper records. And then kind of partway through in that
Amber, that's terrible.
I know. And then like partway through in that second practice, we tried to transition to electronic and everybody was like, this is too hard. And so then I fast forward a couple of years, I go to a practice that only uses electronic records. And I was like, why haven't I been doing this for all these years?
Yeah.
I mean, like, it is so much harder to write.
Of course
everything
it's hard
down.
Yes. Of course it's hard to transition. I get that. But it's so worth it.
Yes.
And I never practiced with paper records. The closest I came was our lab work got faxed to us.
Oh yeah.
And you come in the morning and the fax basket would be, piled up with labs. But I can't imagine. My handwriting is so terrible. It would be malpractice basically for me to write a medical record. I'm sure of it.
Like, this is illegible.
It is, yes.
Another question. I mean, I think part of the medical record could be a burnout. How can creating a better work environment reverse the trend of like burning out? Like, I know there's a lot of like transition, like there's a lot of changes in Banfield. There's so many vets moving from one clinic to another.
Yeah. Can I just say, like, when I heard about the model of modern animal, I was like, yeah, right. How can it possibly be less stressful in a full service clinic? So tell me your secrets.
Let's see. We've been constrained by functionality and design in veterinary medicine for so long. This surface has to be made out of this because, dogs pee on things. Sorry, but it's true, right?
Yep.
Or, we can't have nice furniture because it'll get dirty. Or, we can't make the walls a lovely color because that might cost extra money. And I think we've just we were so utilitarian that we didn't think about this. And, we're not the only people who are building beautiful practices, but, we just wanted to challenge that because, we really believe that if it feels good to be there, it will lower the stress. But trust me, that's not all. Like, that's not enough. You can't just make a nice practice and be like, go do your job now in this beautiful practice. I think one of the really important things, there's probably two big things. One is making it so that there's no phone in the practice. And so people say, that's crazy, you can't do that. But it turns out you can. So our virtual care team handles all of the inbound communications.
Oh, okay.
And that means, but you know what? 80% of the time, those communications are coming through chat. They're not coming through the phone. So what that tells me is if you give people the option to chat, i.e., using the chat feature in our app, they will take it. And I don't like making phone calls. Like I would rather not be on the phone making phone calls to set appointments or do whatever. So our experience is that people want that. And so then what's the byproduct of that? The phone isn't ringing in the clinic.
No stress.
So it decreases the sound tremendously. Yeah. And we also have cages from a company called Casco. Casco was started in the UK by an entrepreneur whose dog was very sick and was in the hospital for a long time. He was appalled at metal cages and how noisy and clunky they are. And so they created these very beautiful cages that have lovely lighting, and they also dampen the sound.
That's good.
So that's been really key too. We don't have a lot of dogs barking in our clinics. I've seen some of our clinics put iPads in the kennels with Bluey on. Apparently dogs love Bluey, and you can make a stressed out dog calm down with Bluey. I don't have any science behind that. The other thing is all of our team members are certified in low stress handling.
Oh.
And so one of the things that I learned when I took that coursework was how stressful it is to the team to deal with a stressed out patient. Many's the time I've had technicians like laying on dogs, kind of sitting on them, dogs that were clearly stressed. And, our mindset was just, we got to get this done. We got to do it as fast as we can. And we've completely changed that mindset to approach the animal on its own terms. And if it's not working out, here are some drugs. Yeah. Please give them to your dog and come back tomorrow. And, that's where the membership model, I think, really comes in to play for people, because most of our clients have the membership. They don't pay an exam fee every time they come in. So if I say to you, here's some trazodone and some gabapentin, give it to your dog and come back tomorrow, the first thing they don't think of is, great, I have to pay another exam fee to come back. Yeah, that doesn't play into the role. So I think all of those things combine together to just kind of take everything down. Yeah. The other thing is that when your pet is not stressed, you're going to be much calmer. Yep. And people are much calmer. We work really hard to provide a great experience for the people. And turns out it makes a nicer place to work. So
that's true. I have to say that's how I am with Tuxedo. Because I think with all the vet experiences that he's been through. I think he doesn't really like vets or going to vet clinic. He shakes when he knew, like, just when we pull over and like, okay, we're
Sorry to
about to
hear
park.
that.
Yeah, but
That's really that's really terrible. I mean, that means his whole life, healthcare is going to be hard for him. So
yeah, but I think trazodone and gabapentin helped, and having
for
Doctor
sure,
Ever around, like, pacifying me and telling me it's okay, because we did 2 surgeries with him. He's 12, but he's very healthy, and it's just
that's
like
great.
I'm the one who's anxious going to vet visits.
You
So
might need some trazodone,
I
Donnie. I
think
don't
so.
know.
But that's good to know. I think, as I said, like, the more I get to hear on your side, like, the more I get to be more at peace with
Right.
whatever you guys like tell us what to do. Because, like, again, I have friends that were like, "Oh, do not give them like vaccines." Like, I'm like, "Oh, that's weird." And then, all the, what's this, tick, flea medicine. Like,
Hmm.
there's a lot of misconceptions out there. And I think just hearing from the vet side and why it's important. And, again, there's a lot of, educating for pet parents like me.
Yeah, I mean,
Yeah.
and you're clearly on the side of science. You've created this company where you're very committed to, ensuring that the products you're selling are in fact what they're selling, what they say they are, right? So,
Yeah.
obviously that resonates with you. Yeah, better living through chemistry. I always say,
Yeah.
you use the drugs when you obviously have to.
Yeah.
Yeah.
So day to day, like what is the day structured like in a clinic? Surgery schedule, appointment times, those type of things.
So, I guess the first thing I'll say about surgery, and this is something that's been, very much my crusade, I believe. When I practiced, I did a lot of surgeries with the book open on the Mayo stand next to me because
Wow.
I'd never done them before. Or, maybe I had a veterinarian in the hospital who would like, okay, I'll help you do that. I'll come in between
Yep.
appointments. And
Yep.
that felt bad. It really felt like I was not delivering the right standard of care because I'm doing this surgery for the first time on a patient that is owned by a person who loves it very deeply. And oh, by the way, I practice in a town with one of the best vet schools in the world, 4 miles down the road. So how can that be right? So I wanted to create a model where doctors could indicate, what surgeries they feel comfortable doing by themselves and then only get scheduled for those surgeries. And then as they grow and improve in their skills and we are constantly teaching our doctors new surgeries, new techniques, they can then take on those additional surgeries. So that was really important. So our doctors, usually the practice has one procedures flow, as we call it, every day. And that encompasses both soft tissue surgery, which is like spays and neuters and mass removals and, all kinds of things like that. And then they're also doing dentistry in the same day in 2 different rooms, obviously. We really work to empower our technicians to do the things that they know how to do and they love doing, because we feel like that will create a lot more engagement for them in their job if they feel like they're doing like the work that they're capable of doing. So hopefully our doctors who are doing procedures are able to, be in the surgery suite doing a spay and they can see into the dental suite because we usually have a window between the 2 rooms. Their team is in there getting the dental going, taking the x-rays, doing the exam, and then the doctor can finish and come on in. So that's how surgery works. We usually have between 1 and 4. We have a couple of really big hospitals that'll have sometimes 6 and 7 doctor flows seeing either exams, and those are just standard scheduled exams for very routine things like wellness or maybe an ear infection or something non-urgent. Those appointments are 30 minutes in duration. And then we also have urgent care, and they're either dropped off with us, or, they're some of them are appointments depending on, we try to leave it to the doctor to decide how they like their urgent care flow to go. So
Okay.
our doctors are seeing between 14 and 16 patients a day usually.
Okay.
Oh, that's cool. So I was about to ask, like, how many patients, 'cause I've noticed, like, it's within that range that I see, and my guy's vet.
Yeah.
So
Yeah.
I guess
I
that's
mean,
not.
that's another contributor to burnout, I think, when you're asked to see lots and lots and lots of patients. And
Mhm.
we're very we try very hard not to add additional patients to the schedule. Depending on the doctor, we always ask them, are you comfortable seeing this patient? He needs to come in. He's not doing well. The other alternative is emergency care. And if the doctor already feels like, look, I've got all I can handle on my plate today. And Amber, as well as I do, some days every dog is healthy and some days every dog is sick.
Yeah.
And so we wanted the doctor to really be able to say, how they run their day and how they see patients.
Okay. So, on that note, how do you balance the financial realities of pet parents with the medical needs of their animals?
Most people don't have pet insurance, right? Very low percentage of people have pet insurance. What we found at Modern Animal, we always ask people when they on board, which means they go through the process of signing up, in our app. We always ask, do you have pet insurance? And 40% of our members do have pet insurance,
Oh,
which is
wow.
tremendously higher than the industry average. So
Yeah.
that's one thing. I think we just attract, I won't say a more financially secure client, although we probably do in a lot of cases, especially here in LA, but
Yeah.
we probably attract a client who's just in general more motivated. So, we have a big bunch of millennial clients. I mean, they're the obvious user, right? They love using technology. They want everything on their phone. They also are big purchasers of pet insurance.
Yeah.
So that's been a real key. We also offer plans through a firm, which is just a regular retail organization that,
That's cool.
like if you go to checkout online, it'll say, do
Yeah.
you want to pay in 4 payments? So a firm has been a good partner for us.
That's amazing. I love that.
And I think finally, though, it really comes down to working with people. And that goes back to like, how much less time can I spend writing a medical record and how much more time can I spend
Like help. Yeah.
building like a partnership with this person. And
Yeah.
so what I want my doctors to do is, and the technology should help them do this, I want them to present people with kind of a roadmap of their pets, like, here's my vision for your dog's health. Yes, he needs these vaccines today. And yes, he needs to be on flea and tick and heartworm prevention. But there's also these masses that I really want to know what they are. But like, let's talk about how we take care of all of that, maybe all today or maybe over time. And so technology should help that, right? I should be able to quickly show you an estimate of the charges for doing something like that. And if you decide you want to take that off or add something back, that should be really obvious to you. So it's always been something we've been really committed to, is everybody sees what things are going to cost before they pay for them. I don't ever want somebody leaving and saying, I had no idea I was going to pay for that.
Yeah.
So that's to be really clear to people.
Yeah.
That's good. That's good to know, because like I feel like that's very important. Like I mean, we have insurance for both of our guys, but not a lot of people have that. And
They don't.
I mean, it's great now that there's payment plans, like not just a firm, like there's Afterpay, and I think I don't know what I think we also have Shop Pay, like that you could pay on like decide how many times in a week you pay or in a month, because we do offer that too in our website, like for
that's great.
Yeah, so I mean, it just changes everything.
It does. And, many people are shocked at the cost of care because you don't ever know what your health care costs. You have insurance, and even then the insurance companies don't pay the actual retail price. It's all negotiated. So
it's like 70%, I think.
There's definitely a wall between, us and the actual. So when we say to them as veterinarians, blood work costs $345, people are appalled. How can it cost that much? I don't even pay for the blood work. I just have done it. My doctor's like, well, yeah, somebody did. The insurance company did. So that's always a big education piece.
I had someone I didn't even know who approached me at a family party, somehow found out I was a vet. And they were complaining about how their urinalysis for their dog was like $45.
Oh wow.
That's a bargain. They were just kidding.
Yeah. And she was like, I've never paid that much for, stuff on me. And it was so weird. Like just before that, I had a urinalysis done on my son because I thought maybe he had a UTI. And it cost me $1,200 out of pocket. And
oh my gosh, really?
For the visit and the urinalysis, and he didn't have an infection. So I'm like, well, $45 in my mind is not that big of a deal, you know? So
Not
yeah,
at all.
you're right. There's a lot of sticker shock in veterinary medicine because most people have health insurance that, you know, helps with the cost, even if it doesn't cover every single thing. So yeah, laying it out, having those estimates, those costs up front, definitely helps.
Yeah, I think so. I think the emotional aspect of it too. I love this dog and I want him to be well. I want to do everything for him, but it's all coming out of my pocket, you know? I think that just takes it up another level for people. So
Yeah.
I totally
I think
sympathize.
it'll be nice to bring in like an insurance company for pets here in the podcast to explain the importance of it.
Yeah.
Oh yeah, that would be a great discussion for sure.
Yeah. I had a client years ago that, you know, they got a puppy, they got pet insurance right away. And then, you know, a year down the road, the dog started having symptoms like severe losing weight, vomiting, diarrhea. They went through test after test after test, finally went to specialist, you know, abdominal ultrasound, liver biopsy to finally diagnose like this genetic liver condition.
Wow.
And they told me they spent $10,000, but that the insurance, because they got as a puppy, the insurance reimbursed every single penny. And I thought, you know, most dogs would have been euthanized before that point.
Exactly.
Of course, because who could afford that? I mean,
right.
And of course, this kind of unknown thing that's taking all these tests to figure out. It's like they're probably wondering, you know, when will this end? When will we get the answer? And every test led to another test, and so that can be so hard for people. If you know you're going to run the test and get the answer, you're like, okay, here's the $500. I'm willing to do that. But when it keeps going on, it's very challenging for people. I get it.
Yeah. Yep.
Yeah.
Yeah, I know. Anyway, well, looking ahead, like you discuss about innovations, AI, model, like what innovations do you think that will shape the future of vet medicine or care?
Yeah. If I look in my crystal ball, let's see. I mean, it's so interesting to me, and you guys are probably talking to me at a bad time to ask me this question. And I remember people coming up to me and saying, you are breaking the law with what you are doing.
Oh, wow.
Yeah. And I was like, you know what? I'm just trying to help people figure out what's going on with their pets. And I'm not trying to break any laws. I didn't understand how it could be so controversial to just answer people's questions about their pets. But I have watched the journey of telemedicine as it has, you know, taken various shapes and forms throughout the years. During the pandemic in California, we were able to practice what I call true telemedicine, which means actually talking to people about a problem that we have not seen them for in the clinic. And, you know, I don't know, Donnie, if you've ever used like telemedicine for yourself or anyone in your human family, or you, Amber, but the rules are dramatically different. I mean, you can get something prescribed for yourself without ever even talking to a human doctor. But for some reason, this idea has really taken hold in veterinary medicine that we have to see these patients because our patients don't talk to us. So we have to do a physical exam. And you know what? You can do telemedicine and human medicine on babies and on nonverbal people. So I really don't know that I buy that. And I also, this is something you alluded to earlier, Amber, like I have missed stuff on physical exam. Like it is not the end all be all. There are plenty of times when I have discovered something later or another doctor has come along behind me to say like, oh, I heard a heart murmur on that dog or whatever that I did not catch. So this idea that we have to touch a patient is really going to hem us in terms of how we deliver care to more people. I'll give you guys one more example. So California passed a law 2 years ago to allow what we call the virtual capture of that relationship, meaning I could see a client on video and I could talk to them about what's going on with their pet, and I can diagnose the condition and I can prescribe. And it's up to me to decide as the veterinarian when that's appropriate. And I know all the veterinarians I know, none of us wants to hurt an animal. And I strongly believe that if I did not feel like it was an appropriate time to use telemedicine and I instead thought they should come in and see me in the clinic, I would recommend.
Yeah.
So we are kidding ourselves as a profession that, oh, we're taking care of these patients in the clinic. We're not even seeing them because these people they don't have a car. They don't have the money to put gas in their car. They're disabled. Whatever the reason is, they're not coming into a physical practice to see a veterinarian. And so what I am most excited about is the idea of expanding our reach and really helping people and pets that are not being helped by the system today.
Yeah.
So I'm proud of California for making that move. Arizona, Florida, Colorado, New Jersey have similar laws. There's more states these things are being considered in. And I just encourage veterinarians to ask what could actually be possible if we started like really thinking out of the box about some of these technologies and modalities.
Yeah. I think you explained that in such a great way, Christie, because when I first heard about telemedicine, or I thought the physical exam is so important, which I totally believe that. But
I do too.
Yeah. But I think any reasonable veterinarian, if you're on a telemedicine call, and this patient needs to see a vet in person, you're going to recommend that. You're not going to say let me just prescribe this to you and hope it goes away. I actually worked for Pet Coach for a while, and I think that was the big consensus in all of the vets that worked there. We would answer the question. If it was something serious, we'd say go into a vet. We wouldn't just rely on that, but it was kind of that stopgap between, do I need to go in? I need some advice right now. So yeah, I quickly turned to be like, yes, this is important to extend care to those people who, like you said, can't come into the clinic, and at least give them an expert opinion.
Absolutely. And have it be from a veterinarian. If I have decided that I want to be a horse vet, I could do that. But based on there is nothing stopping me from doing that except me saying, that is crazy, Christie. You're scared of horses. Like, you don't even know the first thing about horses.
Yeah.
So obviously, I'm not going to do that, but that's totally legal for me to do.
Yes.
And the idea that I can't use my judgment to decide when it's appropriate to use telemedicine, but we think that it should be the decision of the veterinarian who knows the patient and knows the owner. Well, that's great. Yeah. Like, why don't we do the same thing for telemedicine?
I think it's important to have options. Like, telemedicine is really good. Like, let's say for this guy that eats a lot of turkey,
by the way.
He's been crying, and I'm like, I have to text Cal, can you bring him over? Because he's staring at me.
My dog has been upstairs barking. I didn't know if you could hear it.
No. I mean, you already have history. And then let's just say, not everybody has access to Dr. Amber. And I have a lot of medications, like he has a lot of trazodone and gabapentin that I get. And I always wonder, like, okay, can I still take it? Like, even if it's, it's been a while, that maybe 2-3 months he haven't taken it, like, and he hurt his back or whatever. Is there a way? And if I have access to somebody that I can talk to right away and tell me, it'll be helpful.
And I'm sure, if you talk to somebody about that, they might give you the advice that, like, yes, you can try this, but if he doesn't get better, you need to go in, right? And here are the things that could be going on. So here's what I want you to watch for. Like, there are ways to do it such that it's very, I think, very judicious. California law also says you can't prescribe antibiotics for more than 2 weeks. So I think that's great. We don't want to contribute. We don't want to just give out antibiotics. And the other thing it says is you can't prescribe controlled substances. So, I mean, I think there are appropriate guardrails to the law and by the way, Ontario and Canada has had veterinary telemedicine for 10 years. There has not been one single board complaint over the use of telemedicine.
Wow.
Thousands and thousands and thousands of patients. So
interesting.
Yeah, let's be more like Canada.
Yeah. I'm thinking about like the mid-level practitioner.
Oh,
What are your thoughts?
I love it. Of course I do. I'm a renegade. Look, I was at Western yesterday, like I said, speaking to the students, and man, I don't know who's been talking to them, but one of them brought that up. Don't you think this is a terrible idea? Look, it may not be for every practice, but like going back to the burnout question, like, what if I could see fewer ear infections and then I could instead do more dentistry or more surgery, which I love, and which, by the way, is a higher revenue use of my time anyways. Or what if I could spend it on the phone or over video with my clients who have questions? Like, I just believe that like we should approach it from a point of curiosity more than just immediately like, this is bad.
Yeah.
This is a bad idea. I'm excited to see what it's all about. They're teaching it at Colorado State. You and I went to vet school, and we know it to be the best vet school in the world, even though some people don't agree with us. But Colorado State and Lincoln Memorial in Tennessee will be the first universities that offer this program. And I've looked through the curriculum, and it's quite rigorous.
Okay.
So I'm very encouraged. I don't know that it's the answer to all of the problems in the industry, but I think we could do some things that would really help our doctors, just with their workload, and also, again, extend care to people who currently aren't getting it.
Yeah.
Okay. That's a good explanation.
It's also a very controversial one, the mid-level practitioner
because
question.
honestly, my first thought was like, absolutely not. I think part of it is that just one more person that I have to watch over? Like, are they practicing under my license and it's another person that I am liable for? So I get like that person taking some of those more minor cases and, a DVM taking the more serious cases.
Yeah.
But also, am I going to be responsible for all of my cases and their cases? That's kind of
just like you are now. When you have a technician intubating a patient for surgery, you are absolutely responsible for that, right?
Yeah.
So sure, the difference is this person is going to have 2 more years of school to learn these things. And I just, look, the mid-level practitioner in human medicine has not always been, I think, in certain situations, the right answer. But I honestly, I use a nurse practitioner myself. I love her. And she has helped me more than any MD has.
Yeah.
So I think it's going to be very individual, just like everything else is in life. Some veterinarians are better than others too. So
sure. Yeah.
I'm very excited to see what happens and what comes of it. And I'm excited to, at some point, hopefully Modern Animal can use these folks too.
Yeah. I feel like you guys are trailing, like, what can be done in the industry. I think Modern Animal and VG.
Veg.
I love that Tuxedo had another like playtime accident, and we were traveling out of town, and this is the only place that we can go to. I love that the vets came. You can see surgery of your dog. Like, I love the openness. And
no, they have changed they have spun the veterinary ER model on its ear, and I think that they're just doing such tremendous things. I'm a big fan.
I just wish they have more clinics here in LA, but the closest one for me is Encinitas, so it's kind of far.
Oh, really? Wow.
Yeah.
Well, they have one in Anaheim now and one in Santa Monica.
Oh, okay. Well, I'm in the right, so maybe closer to you. But
my dog ate a whole bunch of chocolate one night. Could have killed him. Should have killed him. Let me just say that. Should have killed him. He ate enough chocolate to die. And 3:30 in the morning, and I drove past numerous emergency hospitals to go to Veg in Santa Monica for that reason. For the reason that I knew I could stay with him the whole time. And I think it's an important model, and I hope more hospitals adopt it. But
I know.
Yeah.
I know our guy. I had the new rescue. Like, he ate like, I think, a bunch of grapes, and he was just like a month away. We were in a convention, so we have to fly.
Is he okay?
He's fine. He's a street dog, but in my head, I'm like, oh my God, this is the only time that I'm gonna say goodbye to him, because like, I don't know, because grapes, you don't really know, right?
Well, it's hard to know what's toxic, but yeah,
Yeah,
they can be bad. So
but he's fine.
good, good.
These guys are crazy.
Well, that was crazy too. Like Grape's story, because they saw it on their camera. Right, Donnie? You were in Florida checking your camera and saw him jump up on the table and eat the grapes.
Yes, they were just, oh, it's funny. I think Martin finished Dad's grapes. And we're like, no.
Wow.
But got him right in. He was
Oh my
fine.
God.
That's
Yeah.
good. That's good.
Yeah, but
Yeah.
luckily we're so close to VCA, the 24-hour, the emergency clinic.
Oh, good.
Yeah,
Yeah.
but I still wanted veg open by me.
Well, drive to Santa Monica. They're not that far. Yeah. Yeah.
Well, yeah, okay. I don't want to think of that.
Yeah. Hopefully you won't need them, but
Yeah.
they're there if you need them.
I want these guys to be healthy.
Yeah.
All right. Well, takeaways, Dr. Amber.
I think you've changed my mind, Christy, that I can see.
Amazing.
Yes, I can see. Not that I ever doubted you, because you're amazing, but like I said, I was very skeptical at first. Like, how can you possibly change the design of your clinic or improve the technology and actually make it easier to practice veterinary medicine, less stressful, better flow? But I think Modern Animal sounds amazing.
Yeah.
Well, I would love to show you a clinic one day.
I would
come
love
to LA
to.
sometime.
Yeah.
Yeah, Dr. Amber, you
Right.
should visit us. And there's one by us,
Should.
close by Glendale. It's bougie. One in Pasadena.
Thank
Right
you.
up your alley,
That was not
Donnie.
what we were going for, but thank you. Yeah.
Well, I think for me, my takeaway, like, I love that, you guys are really like pushing for telehealth, because I feel like that's a really great option for people that can, have access to, full health, like, let's say, insurance, or like have access to like vets nearby, because it really, 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 really help. And, what else? Like, it's good to know that AI is also helping, but again, it's also great to know that, being responsible to it, using AI in practice. I'm just excited for Modern Animal.
Well, thank you so much, guys. It's been a great conversation. I've really appreciated you having me on. Thank you.
Thanks again for joining us today.
Thank you, Christy, so much for our conversation today. I've really enjoyed it. How can our listeners follow you? Is there anything they can do to keep in touch?
I'm so overexposed. You can certainly, I'd love to connect on LinkedIn with anyone in the industry who's interested in, continuing any conversations today. I'm also on Instagram at Dr. Long. And at Modern Animal, we're on TikTok as Modern Animal Vet and Instagram as Modern Animal. So look us up.
Thank you to everyone who tuned in today. Don't forget to click the follow button so you'll be notified about our new weekly episodes.
This is Dr. Amber. Thanks again for listening. We'd love to hear your feedback. Let us know if you have any questions about this episode, and we'll answer them in an upcoming episode. Email us at podcast@vitalpetlife.com.